Okay, good morning. I see a couple of people are still jumping on. Numbers are increasing. Just before we start, if I could just ask guys to just start letting us know where you're from and what you do, just so we can see that all is in order. There we go. Got Gerard here. Thanks, Gerard. How's it, Fatima? Joel's online. Leonie. Morning, everyone. Okay, so we'll just give and John. How's it, John? Okay, a couple more seconds, and we will get cracking. Hey, Leanne Gordon. Welcome, Leanne. Okay, I think let's kick it off. So, good morning, everyone. Thanks for joining us today, and welcome to the HR Indaba Network Webinar, which today is proudly brought to you by Alexander Forbes. I'll be putting a message in the top of the chat shortly for the guys that are still jumping on. If you could just let us know who you are, where you're from, and what position you hold, that would be great. I would also like to encourage everyone during the session to ask as many questions as possible, which we will endeavor to answer in the last 15 minutes or so of the session. If we don't get around to answering them all, we will ensure that all questions are answered, and I will send you a personal mail in the coming week with the answer to your question. So today we focus on mental and physical well-being, the boundaries HR should establish for a changed corporate world. Now, balancing work and home life at home, playing multiple different roles, including parent, colleague, cook, friend, boss, and housekeeper, have presented many conflicting challenges for us all, including confusion, frustration, alienation, and in many cases, depression. But at the same time, we have also led to increased productivity and improved work-life balance. So in this webinar, Myrna Sachs, who is the head of health management solutions at Alexander Forbes Health, will take a look at this future normal and how it enhances and detracts from employees' mental, emotional, and physical well-being. She will look at how to handle absenteeism and incapacity when employees aren't physically present. She will also examine how HR can balance the business's requirements with the support needed by staff, delivering a playbook for changed workplace circumstances for line managers, HR, and business. But most importantly, she will discuss the importance of establishing boundaries for both the business and its employees in an environment where these are increasingly blurred. So I'd just like to ask Myrna to just quickly jump on camera. Cool, thanks, Myrna. Before we get started, I'm going to run a quick poll. It'd be great if you could all just give us your answers here, please. Starting it now. So poll is, do you feel your company has the understanding of the cost and level of absenteeism in your organization? We'll give you guys 10, 15 seconds. You're all generally very quick with your responses. And then we will kick off. So quite interesting. I don't know if Myrna, if you can see in the chat on your side, the responses coming through. There's a slight leader at the moment. And then the other two are sort of also fill up pretty much 50% of it. So I'm going to go about five more seconds. And okay, I'm going to end that. Cool. So Myrna, I hope you can see the responses there. So 49% of the people say they do feel that their company has the understanding of the cost. 28% no, and 22% trying to figure it out. So it seems half of them do and half of them not, and still busy working with that. So hopefully a lot of that will be covered during your presentation. So without further ado, I'm just going to stop this. Myrna, bring up your slides. There we go. And Myrna, over to you.
Thank you, Nick, and welcome everyone this morning. I know in Joburg it's getting a bit overcast, but it's been hot, so looking forward to a bit of cooler weather. What I'm going to take you through today is the boundaries that HR should play to establish the changes now. And it's an ongoing process. The future normal, we used to call it the new normal, people hated it. the future normal, it's a challenging and ongoing process. We don't know what tomorrow brings. There's still so much uncertainty that's happening that we actually don't know what changes they're going to be. So there's a lot of uncertainty that our employees are also feeling. They still have collision roles. Yes, schools have gone back, but our employees are still playing parent. They're still playing teacher, should I say. It's still worker, partner, as Nick mentioned earlier, caretaker, parent. We're the CEO and the CFO of our own lives. And we need to manage that. And that talks to the boundaries that we have to set. I don't know if any of you in the audience today, your computer's on because you're sitting at home. So you walk past it at 7 o'clock at night, you quickly check. 8 o'clock at night, you quickly check. 6 o'clock in the morning, you can't sleep, so you quickly come back to your computer. It feels like we are continually switched on. And as companies, we need to assist our employees. We need to optimize communication. We need to prevent that stigma. There's still that stigma around COVID. I don't know why, that if you test positive, it's your fault. And you must have done something to be in contact with someone, gone to a party or whatever, but we can get it anyway. So we need to manage that stigma. And we need to be there to support our employees. And I'm hopefully going to give you some guidelines throughout the session. And then develop return to work programs. We are now all returning back to work. What does it mean? Do people have to be at the office or can they still work remotely? What are processes that are put in place? We need to make sure that we actually put those processes in place. Within South Africa before COVID, we were a community under stress. Now it's even worse. According to SADC yesterday, stress has increased by 56% since the beginning of COVID, which is substantial. What Discovery are picking up is that from their psychiatrists, their claims experience has gone up 14%, whereas from other medical practitioners or specialists, it's actually gone down and hasn't increased. So we've definitely got employees in a community under a lot of stress, depression, mental fatigue, not just physical fatigue. And COVID has changed ways of working globally into the future. It's not just South Africa, it's a global phenomenon. And successful organizations will have to be very quick to turn their strategy around and to make sure that they are working together with the new normal. Psychological factors are playing a big role, and there are multiple personal burdens, long working hours, decreased rest periods, increased workloads. People feel that they're working harder. I know in a lot of the clients that we have, productivity's increased significantly. And there are no boundaries. As we say, your manager can phone you at 10 o'clock at night because they feel like you're at home, you should be up and running. I know in the beginning we started working at home. Now it feels like we're just sleeping at work. So there isn't that boundary. We need to be able to, our employees need to set that boundary for themselves. And we as HR or as our managers, line managers, supervisors also need to assist. And we also need to know that we shouldn't be phoning our colleagues after hours or setting up meetings for 7:30 in the morning or 5, 6 o'clock at night. So it has to be a partnership and we have to work together to try and actually maintain those boundaries. We don't know what people are dealing with at home. It's a concern. There's violence, there's harassment, there are pressures at home. We don't know what our employees are going through while they are trying to work. So we need to be cognizant of that. Financial strain. A lot of people are not getting their full salaries or a partner has been laid off. And now there's only a 1-income family instead of a 2-income family. The uncertainty of the future. Yes, COVID, we're in level 1, but the numbers are increasing again. They're not decreasing. The death rate is still going up. It's not stabilizing as yet. So there's that uncertainty for the future. And also the mental health issues, the social isolation. I don't know how any of you are craving that social that social interaction. You walk past a colleague's desk, you went for coffee together, you had a quick chat in the morning when you walk past each other on the corridor. We're lacking that because we are in our own isolated bubbles. And then also the physical factors. Not many people have the ability to set up an ergonomically correct workstation at home. Some people are sitting on their beds, some are sitting at the kitchen table. There are lots of more musculoskeletal conditions coming up that people didn't have before. You're not actually exercising, you're not walking around, so you actually are static more of the day. So there's definitely an exacerbation of musculoskeletal conditions. And as a business, we need to be transparent, and communication is key. And if that's what you get out from today, it's important to note that we need to make sure our employees know what's happening and where we're going with the business, what is happening. Communicate the plan and strategy. Be clear and honest. Don't hide things. There needs to be trust. We need to build that trust relationship between everyone. If there are job changes, communicate what those job changes are, and then communicate the return to work programs. Be cognizant of vulnerable employees, and I will go in later into what determines a vulnerable employee, and can vulnerable employees come back to work or not. So we'll cover that a bit later. And then provide that emotional support. Make sure that if you have an EAP provider on board, that they know what's happening, they know what your company situation is, so that they can actually deal with the employees when they phone in correctly. And also don't make undue promises or promises that the company can't fulfill. Empathy, make sure you are aware of what your employees are going through. I know sometimes it's hard when you have 100 people that you're managing, but if you know that employees are going through hard times, be there for them, be empathetic, and foster that two-way communication. Make sure that within the company, you have somebody who your employees can phone if they need to, confidential, and someone that they trust, and they can actually be there for your employees. And be positive and optimistic. There is positives that have come out of this, which we'll go into at the end. There definitely are positives. We need to harness those positives and actually work on them also. And reinforce the end vision. The uncertainty comes from our employees not knowing what that end vision is, and not knowing, is the company going to be there tomorrow? So, and that's where that open, transparent communication, honest communication comes in. We need to be cognizant of that throughout. We need to look at our well-being of our employees versus productivity and outcome. It can't just be outcomes-based. We need to make sure that we look after our employees at the same time. So it can't just be that your output has to be 100% or 110 or 120 or 130% without actually knowing the difficulties that they're going to go through now that they're working from home or even partially back in the office, to actually have the same outcome as they did in January, February of this year. We need to trust our employees, and it has to be mutual trust. So we need to trust our employees, and they need to trust us as managers, as supervisors, as leaders. Be flexible and patient. If something's not working, change it. Nothing is hard and fast. Set clear guidelines. Know what needs to be done, and our employees need to understand what needs to be done. And reinforce that virtual meeting etiquette, which I'll go into also in more detail, but we need to have regular meetings, and there needs to be an etiquette. We've now got a standard that cameras on, so that you can actually see each other. You can pick up that body language, because that's what you miss from your virtual meetings. And virtual meetings are important, and they must continue. It talks to actually being in touch with your employees all the time. But then be careful of your meeting fatigue. I don't know if any of you in the audience, you have one meeting now. As soon as this finishes, you switch off, you switch on to the next meeting. You switch off, you switch on to the next meeting. You don't actually have time to conceptualize what was discussed in that meeting, or to jot down your action plans and what needs to be done, or you don't have time to actually do the actions and actually put forward anything that needs to be done, because the meetings are just rolling into each other. We're not driving from one meeting to another. So we don't have that time to actually have time for ourselves to introspect and to see what's happening and to think about that meeting and what was the outcome of that meeting. So we're missing all of that. Adjust expectations. They may have to change. So don't be rigid, as I said, and over-communicate. There can never be too much communication. Rather over-communicate than under-communicate. Use video calls, as I said. Practice empathy and understanding, and inquire and really listen. Listen to your employees. When you're having a discussion, don't do 6 million things at the same time. I'm checking emails, I'm talking to you, my video's off so you can't see me, I'm responding to emails at the same time, because you're going to miss something. You need to really listen to your employees. Remote working has a lot of challenges. Health, conflict, confusion, children, finances, family routine, grief. A lot of our employees have unfortunately lost loved ones, or close family members or close friends during this time, or they've been sick, or they've had to look after people that have been sick. And it's not just COVID sick. There are a lot of other conditions because we're so focused on COVID and we don't want to go to hospitals, people aren't actually managing their chronic conditions. So people are becoming sick from their chronic conditions over and above having the impact of COVID. Post-lockdown, there's a clash now. Employees need that socialization, orientation, and they're slower. They're not as fast as they were because they now have to adapt to a post-COVID or post-lockdown reality, whereas employees are productivity, focus, fast. And there is this clash that we need to actually manage within the workforce. As line managers play a key role. And as HR, we need to assist our line managers. And we as HR are also line managers. We are ideally placed to actually pick up any challenges that our employees are facing. From an absenteeism, a presenteeism, change in work performance, change in attitude, because we're dealing with them every day and we're picking up some issues. Now, the problem with absenteeism and presenteeism is that we're not present, we're not actually actively in the workplace. So how do we manage that absenteeism or that presenteeism? Because it's got a different meaning now. When people are sick now, they still carry on working. They don't take sick leave or time off from the office. So what they do is they'll lie down for half an hour, then come back and work. So they're not getting the adequate rest periods that they need to recover properly. So it's taking longer to get back to full function. So it is something that we need to be cognizant of and take note of and try and manage it correctly. A lot of our clients that we do absenteeism management for now, there's a lot of underreporting, and we can see. And it's also because that people are actually working through their medical condition. So we're not picking that up. As line managers, as HR, we need to continually have those check-ins with staff. Monthly meetings, weekly meetings. We find that the weekly catch-up sessions help. But when you have 2 a week, try and do one work and one just as a huddle, no work discussions. Just the general check-in. How are you doing? What is happening? How's the family? If someone was sick, how are they doing? So just to have a general discussion within teams on how people really are. And then have for example, a Wednesday morning connectivity, what you're working on, what's happening, where we're at, and actually do project management there. One-on-one sessions are still feasible, but bearing in mind, you've got to be careful of your meeting fatigue and that people still have time for all these meetings, but it can't now, because we are 7 months into lockdown, that we forget that we need to actually touch base every day and keep checking up on staff, support those that are struggling. And loneliness is a big thing. A lot of us are blessed because we've got family at home, but a lot of people are sitting on their own. They have no family at home, and they have that loneliness, anxiety happening. As HR managers, what we need to look at is it's a totally new way of working. It's something we never envisaged this a year. We'd never have said a year ago that this is how we're now managing people. So we need to see, how do we support the business? What are the new ways of supporting the business? We need to use existing structures, such as our employee assistance programs, policies, but we need to build on them. We need to give official information that is shared by government and health authorities, but open and honest communication. And if something is shared, we need to share it with our employees. Provide a helpline for people to actually raise concerns and ask for help anonymously. A lot of employees don't want to phone their managers. They're too scared to actually say, I have an issue, because they feel that HR or their managers will think lesser of them, that they think they actually can't cope. So, do we need them in the organization? So they actually are too scared to come forward with those. So we need to make sure that there is somewhere that they can phone that's confidential. Provide assistance or links to local or national resources. Yes, people know what COVID is, and we've been inundated with information, but new things are coming up all the time. Vaccinations. The second strain of COVID is different to the first strain. So they're seeing that respiratory conditions and fatigue is lasting longer. So you are going to have people out of the office for longer. So share information with your employees. Ensure return to work policies are flexible and that they are in place, especially for your vulnerable employees also. What have we got in place for our vulnerable employees? Are they validly vulnerable employees? I'll go into more detail shortly on that. Maintain healthy operations. Look at your sick leave policies and your other policies and make sure that they're flexible and that you actually can work with them. And telework, telecommunication, telesales, make sure that that is in place. Monitor absenteeism and create a roster for trained backup. We don't know when someone's going to be infected with COVID and be off for 2 weeks. We also don't know how people are going to react to being positive. I might land up in hospital, whereas you might be actually just have some flu-like symptoms or a bit of fatigue, but you can actually carry on working. As long as you're isolated and at home, you can carry on working. So every person is different, and we cannot judge one person against another. We can't say, well, so-and-so managed to work, why can't you? Everyone's body is going to react differently, and that's the problem, and that's the issue with COVID, is that we don't know. We don't know who's going to land up on a ventilator. They're young people, I know people in their early 20s who are now in hospital. So we just don't know how people are going to react. Promote resilience skills as a wellness initiative. Run resilience programs within the company to actually make sure that our staff are empowered and know what to do. According to a workplace health consulting leader, Wolfgang Siedel, he said, we need to create a sense of control and sustain our sense of community. So within teams, we've already got a community base that people are working towards and together. We need to contain that and make sure that we provide meaning in a crisis. Showing up makes change. We need to be active. And we also need to practice what we preach. And as Simon Sinek said, good leadership is not about taking charge, but about taking care of those in our charge, which is very profound. If we look after our staff, they will look after us also at the end of the day. If we just briefly look at absenteeism in the COVID environment, we need to make sure that our health and safety policies and procedures are in place and that there's a balance. Our employees have a balance between being sick and productivity, and that everybody is dealt with the same. So we need to make sure that health and safety of all our employees is key. We need to make sure that we've got policies in place. And I know 50% of you said that you think your organization is aware of the cost of absenteeism and what the effects of it. So I'm assuming with those, that policies are in place for you. And you need to make sure that you keep on updating it, because the absenteeism policy that we had in January is very different to the one we have now. Now we have quarantine, isolation, vulnerable employee leave. There's so many new categories. IOD, is COVID IOD or isn't it? There's so many new categories. And from that perspective, it's not seen as an IOD because you could have got it anyway. You could have been standing in a queue at the shops. You could have been on public transport. You could have even just been walking past someone. And we don't know where we get it from. So from an IOD perspective, in the general terms, it's not COVID is not seen as an injury on duty. And then also we need to identify those who may be at risk and support them, be there for them, and let them know what the policies actually are. So in our absenteeism policies and processes, we need to differentiate between sick leave, so valid sick leave, and we need to make sure that the staff are actually taking that sick leave when it's due. Self-isolation versus quarantine versus comorbidities. They're all different and they all have different outcomes. We need to differentiate also between employees who are infected with COVID or need to take care of an immediate family member who's infected, or they're just too scared to come to the office, so they don't want to come into the office, or they've got preventative withdrawal, or they're in quarantine after being in contact. So we need to differentiate because each one of those will be dealt with differently. And also, who's considered vulnerable? So your vulnerable employees are those over the age of 60 with comorbidities, third trimester pregnancy, immunocompromised, or have a metabolic syndrome. But we need to make sure that if they can't come to work, can there be accommodations in the workplace? Can they actually work from home? Or if they do want to come into work, I know at Alexander Forbes, you fill out the form, they tell you that you shouldn't come in, but if you really want to, you sign an indemnity that you will take responsibility if anything happens. You can do that for your employees. So some people, because of regulations, can't come to work. Some people, because they're scared, can't come to work. So we need to make sure we differentiate and we assist them. Just because you're a vulnerable employee doesn't mean that you're not productive. So from an insured benefit point of view, you also need to make sure that that's taken into account. You can't claim from insurance for a disability benefit because you're a vulnerable employee. You are still productive and you're still capacitated to work. You're not incapacitated to work. So we need to draw that line and define when is the person incapacitated versus when are they capacitated, and make sure that our processes are in place around that. Why do we need to manage employees with health issues? What is the reason for that? And the reason for that is that you want a healthy workforce. Healthy employees are productive employees. And just because you have a medical condition doesn't mean you can't be healthy and you can't be productive. So the consortium is, and the quicker you pick up that someone has a problem, the quicker you can assist them. And the quicker you can get them back into the high level of wellness part of this diagram. So when they have a condition, a medical condition, you have your disease management section. So early detection, you don't want them to actually become a disability. You want to manage them in the workplace effectively to make them productive again. And that is what a well-designed wellbeing program actually looks at. And we'll go into that just now when we look at the 5 key considerations that we need to take when actually putting a proper process in place. And I think that's it for me for this section. Nick, over to you.
Cool. Thanks, Myrna. So just sort of halfway through, we just want to run a second poll with everyone, which I'm going to put up now. And that poll is, would you say you currently have an effective intervention program in place to manage incapacity? Again, I'll give you just a few seconds to please do that. So far, it seems quite an overwhelming answer to that. Oh, okay, it seems to be balancing out a little bit. So we'll just let that run for another few seconds. Okay, up and down. Okay, seems to be slowing down. So I will end the poll in 5 seconds. Okay, and there we go. So to that question of would you say you have an effective intervention program in place, 45% of you say yes, and 54% of you say no. So Myrna, sort of your comments on that particular point at the moment? Oh, yeah, I think you're on mute.
So that's the other issue with these new virtual meetings. It's you're on mute, we can't hear you, connectivity issues. And also what you need to remember when you're dealing with your employees is what is valid and what is not valid. When someone is not concentrating and not focused, how many times do you get, oh, I had connectivity issues, can you repeat that question? So that's why videos on is so crucial. From this question, the effective intervention program in place, 45, 54, I mean, it's much of a muchness. And I'm hoping to give you some guidelines when I go into the next set of my presentation now around what constitutes a good wellness program. A lot of companies have got very good wellness programs in place, and it's managed and it's contained, and they look at it from an integrated approach. So we're not just us, because what happens is a lot of companies will split. So one division will look after employee wellness. Another division will look after absenteeism, and then the benefits division will look after disability. And then you've got a wellness team who looks after wellness days or the medical aid. And never shall those paths cross, and they never speak to each other. So what happens is that you get a lot of duplication of work. You're paying 4 or 5 different providers for the same work. So it needs to be an integrated approach within companies. And even if it's managed between different divisions, those divisions need to have a panel where they actually meet once a month or once every 2 months to discuss trends that they're picking up. Are they all focusing on the right thing? Because what you might find in the employee assistance space, the EAP space, your trends are relationship, finance. Whereas in the incapacity absenteeism space, the trend is musculoskeletal and mental and behavioral. But if the EAP and the incapacity space talk to each other, you'll pick up that the relationship issue actually also impacts on the psychological, mental and behavioral. So, and we need to make sure that when we do education drives or you do calendar health day events, that you're actually focusing on what the issues are that are relevant to your particular employees. Just because this month is Kidney Awareness Month doesn't mean that that impacts your employees. You might have something else that's burning that you'd rather focus on. So you need to make sure that whatever programs you put in place, you've actually looked at the trends within the whole company, not just pockets of the company. So if we look at the 5 considerations, how do we deal with our new normal, the current situation? So in the beginning, there were 3 phases: respond, recover, reset. So respond was we all quick action. Everybody go home, nobody in the workplace. For those that are not in retail or mining industries or operational, everybody set up with computers, make sure that they all have IT connectivity, telephones, computers, everything in place. So it was quick, it was a quick response. Then we went into the recover phase. Okay, we've survived. What now? Let's move forward. Where we're sitting now is in the reset. Okay, it's been 7-8 months. We're in level 1. We will move out of lockdown eventually. What happens then? How do we as a company adapt and thrive? How do we change our focus? How do we reimagine? But at the same time, when we're looking strategically, how do we look after our employees to make sure that we actually have staff to take forward the new strategy? It's no good burning out all our staff now. And then when we want to take forward the new strategy, there actually is we have burnt out staff. They're all on incapacity, absenteeism, disability, or they've resigned because there hasn't been transparency and trust within. So what we need to do is we need to make sure, and I'm going to spend time on this slide, we need to make sure that our health and wellness strategy creates a productive workforce. That's our aim and our goal of a health and wellness strategy. How do we do that? What do we need to put in place? So the first thing to put in place is a wellness program. And as 45% of you said that you have a wellness program in place, that is step number 1. What is a wellness program? A lot of people don't even know what they are and what it needs to be. So incorporated into your wellness program is what we call an integrated health risk management strategy. So when we talk about integrated health risks, your health risks are from when your employee starts working at the company to when they leave the company. It's looking after their health in different stages. So from their medical aid, do you have medical aid or primary health care? If they're not on medical aid, do you have other on-site wellness clinics? What have you got in place? Do you have an EAP, an employee assistance program in place or not? And if you do, what benefits can your employees derive from it? Employee wellness programs can also be structured that you have a 24-hour call center only, or you can have face-to-face sessions also. So it's structured differently to your client needs, to your needs, and to what you can afford. Because often for a lot of companies, it's not affordable to have an employee assistance program or a wellness program or incapacity management or absenteeism management. So what can you as a company afford to have? And then how can you actually tailor make it to make it affordable? And that's what you need to look at. Then it's looking at absenteeism management, presenteeism and productivity in the workplace. Everyone says, how do you rate presenteeism? It's very hard to actually come up with a rating for presenteeism in the workplace, because I might be functional in front of my computer, but I'm actually playing solitaire on the side. How present am I really? But from an absenteeism management point of view, you can rate your sick absence ratios, and you can look at your direct costs versus your indirect costs of absenteeism. So your indirect costs talk to training of other staff members, low morale of other staff members, so productivity decreases. It looks at temp costs. It looks at recruitment costs to replace. So your direct costs, what we say, usually costs the company 350% of your actual salary cost, and your indirect costs times that by 2. So it costs the company a lot of money. Currently in South Africa, it's costing South Africa billions for absenteeism. Now during COVID, there's an additional cost of quarantine cost, being sick from COVID. So there's all those additional costs that we now have to look at. We've just done an analysis on one of our clients where COVID so far has cost the company, just in direct absenteeism costs, 4 million rand, which on a small client is significant at a 1% sick absence ratio. So it's a small percentage of your population, but they're taking an average of 6 days to 14 days leave during that period. And then it's making sure that you've got accommodations in the workplace, or availability for accommodations in the workplace in your whole wellness strategy. So incapacity management. Just because someone has a medical condition doesn't mean that they are disabled, and doesn't mean that they cannot work. So how can we as an employer accommodate our employees? And now during COVID, what it's taught us is this whole lockdown and working from home and remote working, your people with disabilities it's now the perfect opportunity to skill them up, and there are more opportunities for people with disabilities to be able to work from home. So to be able to accommodate our employees and not just put them on disability, you can actually accommodate them better now. So it's looking at what accommodations do we have in the workplace? Do we need to upskill people? Do we need to do sensitization training to people who need to work with someone who's now incapacitated or disabled? What have we got in the workplace? Are we actually training up and empowering our managers for absenteeism and productivity in the workplace? Training on disability, sensitization to disability, health in the workplace. Are our managers empowered? And this all falls into our criteria of a wellness program. And then also making sure that we always look after the 4 pillars of our employees, from a physical, and as I spoke to you in the beginning, on the ergonomics in the workplace. So how are they managing now? Actually sending out a brochure, which we've done to all our clients, send out a brochure on how do you actually set up a workplace at home without expensive equipment. So how do you take everyday useful items in the house and actually make sure that you can ergonomically set up your computer or your chair or your desk? So it's basic things, and these things don't have to cost money to companies to put in place. The emotional side, employee assistance, mental health. Mental health is big at the moment. Suicide rates are going up. SADC and all our EAPs, their services, there's definitely an increase. People phoning in, needing help, needing that emotional support now. Financial, making sure that your EAP providers have a financial aspect to it, where they can help your staff with basic budgeting. Budgets have become very different in the past 7 months. People are cutting back. People are terminating certain things that they don't need, gym contracts, DSTV contracts, unfortunately. So people are cutting back. So it's making sure that you've got the assistance within whichever providers you use, that there's also that financial support. And then the social support. Have your regular meetings, have get-togethers. We've done quite a few very successful team buildings on Zoom. It's not ideal because there's not that social interaction, but you can actually get people motivated and be part of the team. And also make sure when you're looking at the social and emotional together, that if you're sitting in a meeting and you see that someone is withdrawn, take it offline, but remember to phone that person and make sure that they're fine and they don't need that assistance. So in looking at the 5 key considerations are your wellness program, absenteeism management, incapacity management, and please bear in mind absenteeism and incapacity go hand in hand. It's all very well saying, right, I've got these high-risk employees, but what do you do with them? You need to make sure that you've got actions for each person who's a high risk, or that's taking a lot of sick leave. You've got action items in place. You know what you need to do. Is it because they're actually on disability or they have a medical condition that they need to take time off? That's fine. But if it's opportunistic, you need to manage those opportunistic users within the workplace. And then just the last slide before I end, just to bring back this slide, I'm not going to go into it again, but just communication and transparency is key. When you put a new policy in place, make sure that you actually communicate it to the staff. Do your staff actually know that there's an EAP provider? Do they know who their HR consultant is? Do they know where they can go to for any help? Make sure that you've actually communicated that. And then just some positive aspects for the future. It's not all doom and gloom. Definitely some positives have come out of it. Less travel-related stress and anxiety. I don't know if any of you, that Sandton traffic is a disaster. It's a pleasure not having to drive in and out of there. Increased quality of life. Okay, some people are saying that they don't have an increased quality of life because they're now all on their own. But a lot of people have bonded with their children, with their spouses, with their families, with their parents. They've actually taken this time and utilized it constructively. There's definitely in a lot of companies an increased focus on employee well-being, which is vital. So, as I said, COVID has definitely brought some positives. There's a renewed focus on outcomes instead of work hours. So, because our staff are parenting as well as being employees, and they needed to homeschool, and some schools are still at home, or some children are still at home. So, companies need to look at that flexibility. So the staff member can spend 2 hours with their child in the morning, as long as their output and their work and make up the time, their output is there. And we're looking at outcomes, and that's what's important. It's not a 9 to 5 or an 8 to 4 job anymore. It's what is my outcome, and we need to be flexible with our staff. We also need to make sure that there are accurate ways to measure work outcomes, and that definitely has come into the forefront now. We are measuring outcomes more than we ever did in the past. And we're upskilling managers. More and more managers are going for training, being upskilled. They're empowering them to be able to identify staff members who need that support. And we're also empowering them more now to have those difficult conversations that they didn't want to have. So when you've got a staff member who is continuously absent from work, you never wanted to have that hard conversation, that difficult conversation. We're now finding that our managers are being more upskilled. Not everything is pushed to HR anymore. Managers are actually taking responsibility and accountability. So there definitely are definite positives with this working remotely. And we don't know what the future holds. A lot of our clients that we're currently working with, some of them are half in the office, half at home, or they're all in the office once a week. Certain teams go into the office, or everyone is still at home, or you can hot desk at the office if you've got connectivity issues. Load shedding, connectivity. So there are different ways of looking at it. We don't know if work will ever be the same again. So that uncertainty does play into our staff. But if we're optimistic and positive and we're there and we're present, I think we'll definitely all have a brighter future. Thank you all. That's my presentation. Nick, over to you.
Awesome, fantastic, Myrna. Thanks very much. We'll just move now over to a couple of questions that have come through. And I wanted to ask one, but it seems to tie in quite nicely with a question I received privately from Leonie Fantonda, and I'll kind of combine the two. So mine was, if companies aren't making use of wellness providers, what or which particular provider would you recommend? And then Leonie asked, how do you execute a health and wellness program when there is no office anymore? And what are the quick wins you can achieve and that is affordable? So I think the two maybe sort of can tie in hand there.
Perfect. So we currently partner with an EAP provider, Careways, for new tenders or going forward. We work with any EAP provider. So if you currently have an EAP provider in place, we work with them and we integrate the solutions together. But we do partner with Careways for new ventures, or if clients ask us, because we have an integrated approach. So the EAP and absenteeism management and incapacity management is integrated. We refer to each other, which then actually holistically looks after the individual or the employee. And when we talk about, I know this remote, because we're actually not in the workplace. So absenteeism, presenteeism, health and wellness, what does it actually mean? But your quick wins are, your employees are still your employees, and we still need to look after them. So we still need to be sending out education and knowledge and information. So mental awareness. We've just done for a lot of our clients weekly tips on return to work. So every week we send out a different tip just on basic boundaries, setting up boundaries, ergonomics at home. Because we can't call it ergonomics in the workplace anymore. It's now ergonomics at home. So it's actually looking at those things. So just because we're sitting at home, you are an employee also. You're an employee, you have a manager also. So how do you feel sitting at home? What do you want to get from the company? And that's what we need to look at. So we still need to make sure that we're looking after the health and wellness and that there is an EAP in place, because from an employee assistance program point of view, mental health is a massive issue at the moment. And we need to make sure that our employees have that support going forward.
Cool, thank you. I'm just going to just stop the slide presentation. There we go, so we can bring us up nice and big. There was a question in the pre-survey from Georgina saying, how do you draw the line about meetings anytime in a world where it's acceptable sometimes to work after hours? You touched obviously on working late, but where do you actually draw the line?
Okay, so some companies have got this policy where Wednesday is no meeting Wednesday, or between 12 and 1, there are no meetings. However, it's fine for internal. The problem comes in when your client sends you a meeting request, or a service provider sends you a meeting request, and there are 25 people in the meeting, and you can't just decline. So you need to set boundaries for yourself, and you need to be able to say no to certain meetings. What a lot of people are doing is within their diaries, they're actually putting out 10-minute slots as out of the office slots throughout their diaries to make sure that they're not having back-to-back meetings. Unfortunately, I'm guilty as charged. And the problem is we need to learn to set boundaries for ourselves. I think it's a personality, and it's a personality trait that's hard to change. But I think we need to also, I think clients and service providers and employees are starting to actually also understand when people say, I cannot make this meeting. And you also need to make sure that you switch off your computer at 5 o'clock or 4 o'clock, whatever time, switch it off. Don't leave it open. Actually switch it off. And if you go away for the weekend, don't take your computer with you. Or if you take leave, don't take your computer. There's a whole thing now is people are saying, well, I'm at home anyway, why do I need to take leave? Burnout, emotional, physical burnout. So we need to also make sure that we are making sure that our staff are taking leave. I hope that answers the question.
Yeah, I think so. And I think your final comment there also ties in with a comment Lana Hindmarch made, saying also important to acknowledge is that burnout is often an organizational issue and to consider how leadership is modeling well-being across the 4 pillars.
Sorry, I'm going to ask you to repeat that question. Sorry.
Oh, no, so you touched on burnout. So you touched on burnout right at the end. And then Lana Hindmarch also made a comment just saying also important to acknowledge is that burnout is often an organizational issue and to consider how leadership is modeling well-being across the 4 pillars.
Correct, absolutely. And what happens is because leaders are driving that outcome and that output, and they're fast and they want it now, they're pushing their employees also. And sometimes employees are too scared to say that I've got too much work and I can't do it. And just another point someone has mentioned in the chat, and she's 100% right, from if a company can't afford an external service provider, or there are independent people who actually also manage this within the workplace. So it's not that you have to go to a big company to actually assist you with the for any of the 4 pillars. There are individual service providers also who are out there who can assist.
Awesome, fantastic. Thanks, Myrna. Kara van der Merwe asked towards the beginning, asking, is it fair for management to change work at home arrangements without consulting employees prior?
Okay, so I think because the levels of lockdown are change all the time. So from a level of lockdown point of view, yes, the minute we change from a level 5 to a level 4 to a level 3 to a level 2 to a level 1, companies can change what they see as remote working. However, if you've got an agreement in place with a company, with your employer, that can't be changed automatically. But if you are a vulnerable employee and your employer says you have to come back to work, that they can't do. There has to be consultation, especially if you are a vulnerable employee. But in saying that, if you are a healthy 25-year-old with no comorbidities and you actually can come back to work, you need to have legitimate reasons why you're too scared to go back to the office or don't want to go back to the office. Others, it can be seen as absconsion, if I can put it that way. So yes, companies can change in accordance with the levels of lockdown.
Okay, perfect. Thanks, Myrna. Another question from Georgina. She asks, when the honest truth is that we are all under pressure and resources are limited, all of which contribute to extreme pressure, is communicating truthfully enough? And how long can you ask people to cope with the stress?
Okay, it's a double-edged question. It's a difficult question to answer because how long is a piece of string, unfortunately? So I think open honesty, is it enough? I think if you are transparent and the employees can see why there's so much pressure. Let's say, for example, a company will have to close down if certain things can't get done. Then that pressure is going to be there right until that company can turn itself around. And if an employee is a loyal employee and there's trust and honesty, I think that employee will stick with it. Where there's no trust, that employee will probably say, I can't do this, goodbye. So I think it boils down to leadership. And as they say, a leader is there for the employees and wants to grow the employees. A manager manages the employee and pushes the employee to the limits without actually leading that employee. So it's getting that balance. Okay.
Cool, thank you. Then there's a question, I don't know if it's Frangie or Frangie. Apologies if I pronounced that incorrectly. But Frangie is asking, how is IOD dealt with in terms of remote working?
Okay, I've been to a few presentations through COIDA. Unfortunately, their policies are their policies. So there is no injury on duty from home. Currently, there's no clause within their policy that allows for it. So you have to be in the workplace to actually get an injury on duty. Unless they change their rules, there won't be now. Or unless your employer changes your workspace to be home, that it's actually set that this is now your office environment, which I don't think many employers will do.
At this point, at least.
Yeah, okay. I don't think so.
Okay. And then very interesting question from Lusanda. Lusanda asks, how do we determine at which stage to intervene and assist an employee battling mental illness, but is still in denial, but it shows in their work output?
Okay, the earlier you intervene, the better. And you don't have to say, I see you have an issue. It's actually starting that discussion. So having that initial discussion with the person. I see that your output is diminishing, and actually show stats. You must have records and you must actually have valid proof of why you're saying this, but we see that your output is deteriorating. Do you have any issues? What is happening? Can we assist you? If they say, no, I'm fine, you go on to the next meeting a week later and you say, we're still having issues. Unfortunately, we're going to have to call in HR or somebody else to assist. And bring in, and they need to sign. So, for example, if for even any external service provider, regardless of who it is, but for what it is, we make sure that don't interfere, intervene, or get involved unless we have signed consent from the individual. The individual has consent to us investigating any medical or incapacity issue. So there has to be that consent. So the company can say that, I understand you might feel that you have confidential information you don't want to divulge. We will get an external party involved. So there are ways of actually getting involved. The quicker you pick up someone as a mental, or you can do managerial referral to an EAP. So there is that line from an EAP perspective that they do have the managerial referrals, where then the EAP gets involved.
Okay, brilliant. Just looking for one. There's one in the pre-webinar from Ann Peters. How much engagement from senior management is necessary to ensure that employees actually feel engaged? Does that maybe go back to your how long is a piece of string?
Correct. It has to come from the top down. Senior leaders, senior management, HR execs, everyone has to show that they are part of the strategy and that they buy into the strategy. If you want your employees to buy into the strategy. So there's never too much communication. Okay.
Awesome. Thank you so much, Myrna. I think this brings us now to the end. Just before we finish off, I'm just going to bring up one more slide, just to sort of indicate the next webinar that we're hosting. So tomorrow we are hosting a webinar, Employee Engagement in COVID-19, how successful companies connect with their people in times of crisis. This is brought to you by one of our partners, Talentsmith Technology. We have a fantastic speaker based out of UK, sort of HR guru, Deborah Corey, and then two of our country's sort of high-level CHROs, so not to be missed. In case you haven't registered and need to have a look for that, please visit our website, which is chro.co.za/events, and you can log in there, register for tomorrow's session, and hope to see you all there. Again, thank you to Myrna for her time. I think it's been extremely informative for the people that are on this session. So thanks again, Myrna. Thanks to everyone for joining, and we will hopefully all see you tomorrow. Thanks, guys.
Thank you, Nick. Thank you, everyone.
Thanks, Myrna. Ciao, guys.